Hi, I'm good. How are you?
I'm hoping good things will happen through this journey and my health will improve.
Heart disease, diabetes, strokes are the leading causes of health issues and death and disability among South Asians.
I think most of us take our health for granted because while things are going well, nobody's really thinking about what could go wrong. And what SANSAR is doing is trying to help people be proactive so that they can be preventative.
We're providing counseling around healthy living, proper diet, proper forms of exercise, efforts at weight loss, smoking cessation, stress management. And we're providing those coming from the same background.
I know in the South Asian community, there's an aversion to go to the doctor, to get tested, to do all this preventive stuff. This seems to be something in the culture.
We would put you at what we call moderate risk. So if you continue the way you are, it's not going to be long before you are going to be diabetic.
Oh boy, really?
Yeah.
To be on a borderline for diabetes, that was a pretty scary message. Under the 6 criteria, I guess the cholesterol is under control because I'm taking cholesterol medication. That was the first criteria. Blood pressure, thank God, is normal, so that's not a concern. Then the next test was about the blood glucose level, blood sugar level. Weight, of course, is the main underlying issue for me. And of course, with the weight is the waist circumference, which is the last criteria.
SANSAR's dream is to see the burden of heart disease reduced within the South Asian community here in Canada, to see people become aware and start addressing their risk factors at a younger age within childhood, to see the families making changes and working together to address this problem.
If we start taking action now and we're proactive, then we can improve our health, not just of our own, but our families and our communities.
Since 5th of December to date, I've lost 25 pounds. I've lost 4 inches of my waist. Even my shoe size is ½ inch off. Crazy.
आप मुझे देखिए, मेरी जो फैमिली हिस्ट्री है, उसमें बहुत ही हार्ट की इश्यूज हैं, डायबिटीज़ की इशू है, और कई लोग अपनी ज़िंदगी से वक्त से पहले चले गए, लेकिन मैं ये नहीं करना चाहता था। तो मेरे डॉक्टर ने मुझे संसार के बारे में बताया, जो कि जिन्होंने कि मुझे इनकरेज किया, हेल्प की और मुझे राइट गाइडेंस दी मेरी डाइट के ऊपर, मेरी एक्सरसाइज के ऊपर और मेरी लाइफस्टाइल के ऊपर।
We're looking to refine the clinic and the programs that we're offering. We're looking to learn from the South Asian community here, as well as all across Canada, what works for them. We're looking to be culturally sensitive. We're looking to bring solutions that actually make changes in lives.
The way we envision to do this is by having additional clinics, having group education classes, having dietary sessions for patients.
There's nothing called a diet. It's healthy eating, which is good for everybody at home, not just that individual patient.
One of the most important aspects of SANSAR is actually research that is specific to the South Asian population. And this clinic is a tremendous resource in terms of developing that database.
And the more we understand that, the more data we're going to acquire, the more we're going to come out with suggestions so we can address the cardiovascular issue, which is very crucial.
We are looking for individual donors. We're looking for donors to give monthly, whatever you can. And we're looking for corporations and businesses to step up and get behind what we're doing and support us in whatever way is possible so that the programs that we are offering can just grow and reach even more South Asian communities and families all across Canada.
Dr. Kapoor will see me in 6 months, so I'm hoping that every one of these criteria I'll see some improvement. I'm actually looking forward to going back in 6 months. I feel that as a responsible father, grandfather, husband, every South Asian person should get this test done.